I'm so glad you're here. This is a replay of a live training I did inside the OTs for Pelvic Health Facebook group with Lindsey Vestal, and I wanted to make sure that everyone gets access to it. Pelvic health is such an incredibly fulfilling specialty, and it's growing so much. I've been training OT since 2018, and my goal is to have over 10,000 OTs trained by the year 2030. I'm so glad you're here learning about this specialty. I hope that you can join us in the OTs for Pelvic Health Facebook group with me, Lindsey Vestal. I will link to the group below in the show notes and description. Thank you so much.
I think we're live. I'm hoping we're live. Hello, everyone. It's another opportunity for an OT Empower Hour, highlights of my week. I hope everyone is doing extremely well. We have such a fun topic today. Today, we're going to be talking all about starting a program for education and supporting new mothers while they're in the hospital. What is more OT than that? I would have a hard time figuring that one out. I'm so thrilled to welcome Jessica Hamman here today to talk to us about doing just that. But before I introduce her, you guys know I love to start off OT Empower Hours with an icebreaker question. It's a bit selfish, but it's for us to know that you're here. It inspires Jessica and I to know that you're part of the conversation. And so I want you to put it in the comments, the answer to this icebreaker question. And if you are joining us on replay, you absolutely are invited to the table. We want to hear from you as well. So please, please, please put your answer in. The question is, and Jessica, I want to hear from you first. How old were you when you learned to ride a bike?
Ooh, that's an interesting one. I gotta say, I think I was probably like 4 or 5, because I remember my bike, you know, the ones with the baskets and the little things hanging from the handlebars. Yes.
Oh my gosh, those are my favorite. I wish mine still had that. Because you could just put everything in there. I mean, like every tool you possibly could imagine, you could just throw into one of those baskets, couldn't you?
Yes, they're the greatest.
They're the best. They're the best. So I think I was around 6, and I completely remember numerous falls that I had. And I have to tell you, if anyone has not heard of balance bikes, and you have children, you have to do a balance bike. Literally, I have this video I can share with you guys. My son, after being on a balance bike for, I don't even know how long, might have been a couple weeks, couple months, he just took off and didn't fall once. I'm like, my poor knees would have thanked you if I had had this opportunity. Hillary says, what an athlete. She was 6 or 7. Mal says 4 or 5. My daughter recently learned at age 3, thanks to balance bikes. Mal, I got you. Balance bikes are life-changing. 3 years old. That is incredible. Karina says, I think I was around 5. Yes. Oh my goodness. I have a feeling with balance bikes, we're going to start to see kids start sooner and sooner with like so many less scraped knees and elbows. Awesome. All right, keep that answers coming in, especially on replay. We want to hear from you. How old were you? I have to introduce my guest, Jessica, now. She is a hospital-based OT in Pittsburgh, Pennsylvania. She has an almost 15 years experience in acute care and almost 1 year as a pelvic health OT. She is passionate about helping new mothers. Obviously, she initiated a program for educating and supporting new mothers while they're still in the hospital after delivery. Jessica was an OT pioneer. She was also enrolled in my OT Elevate course about colorectal conditions. Jessica, I am so honored to welcome you.
And I'm so happy to be here. I really think that this is a really important topic, and that it's something that's very doable in hospitals and really needed. So I hope that we can spread the word and get this started in some more places.
I think that is exactly what so many people in this group want to do. So we're so happy that you've come on today to share your wisdom and what's worked for you, some of your struggles maybe, so we can reinvent the wheel a little bit less. I want to invite everybody who's joining us at any point in our conversation today, go ahead and throw your questions into the comments, and I will be more than happy to share them with Jessica. I know I'm going to kick it off with my first question, which is, Can you describe the program that you created to us as if you were speaking to your ideal client who was just hearing about it for the first time?
No, honey, go back in. Yeah, so typically what I say is that this is a program we designed based on a need that we saw with new moms. As they're in the hospital, there's not a lot of information necessarily given to them about how to care for themselves. I think the nurses do a really nice job helping them, educating them, giving them the resources that they need as far as like peri-care and some of that type of stuff, how to hold the baby and change the baby, but there's not necessarily the information about how to take care of themselves further on down the line. So there's not a lot of education about their pelvic floor or their abdominals and how to move and how to breathe. That kind of gets overlooked. And with my experience of having my own children, that was kind of something I had to learn on my own, and I had to kind of figure out as I went along. And I really want to empower new moms to know more about their bodies and how to move and how to take care of themselves. So what I usually say is that we started the program just to really provide more education and support so that moms, when they come home from the hospital, don't feel alone, don't feel scared, know that there's someone out there that can help them, even if they go to their OB and their OB doesn't necessarily refer them, they can ask for a referral to pelvic health. And to me, it doesn't matter if they come to me. I just want them to know they have support and know that there's people in the community that can help them.
Absolutely. Absolutely. So I have to ask, what was the reception at the hospital like when you brought them this idea?
Well, I printed out your brochure, so you have on your website, and I don't know if you have a link to it, but you can sign up to have it emailed to you. It's just an educational brochure for postpartum women, and it basically covers all the things I wanted to talk about in my program. And we printed that brochure out and we took it to the OB head of the unit. And he was just blown away. He's like, yes, we need this. Like, these are questions that everybody asks that I don't necessarily know the answers to, but this is like something that we should do. And it was just an overwhelmingly like, yes, why are we not doing this? Are we not doing this? Was kind of the answer. So I was like, yeah, let's do it. So
that is awesome. So it sounds like then the snowball just kept going and there wasn't much resistance once you sort of got that first sign off.
Yeah. So once we got nothing happens fast. So, once we met with the OB doctor, that was the head or one of the heads of the unit, and then the unit manager and one of the head nurses, then they decided that what we should do is propose the idea in a staff meeting with all the hospital OBGYN doctors. So, of course, it took a couple of months to get on the agenda for the meeting. And when we finally did, we presented, and I think there was something going on that day in the staff meeting that was concerning, or that doctors were a little bit upset about. So I think we got pushed back to the very last item on the list or something. But when we proposed it, the main concern from the doctors was, how do we order this? Like, how are we going to check this off or say that we want this? And we started, because of our staffing, we started with seeing the unplanned cesarean section. So we weren't necessarily getting an order for everybody, but all the doctors were like, I think everybody needs this. Like, everybody needs this education. So we're not there yet. We're still kind of just at the beginning. because of COVID and all the other complications of getting a program started. But in the people that I've seen so far, the mothers I've seen so far, the overwhelming response is, yes, thank you for giving this information to me. Thank you so much. And they just feel so supported and comforted knowing that there's people out there to help them.
Absolutely. And are filling in gaps that some of these other specialties don't have time for, may not have the expertise in, right? So it really, I imagine the satisfaction scores and a lot of the overall experience of the client, is also helping to spread the word. And I'm wondering, how long has the program been in operation now at this point?
Well, officially, it's been a couple years, and with COVID, we kind of put it on hold because they weren't allowing extra people in the rooms. So it's been kind of like a start, stop kind of process. But the initial meeting with the OB doctors was in 2019. I think it was January of 2019.
Okay.
But I don't think we started getting orders probably until maybe early 2020, and then we had COVID. So it's kind of been a work in progress.
As most things are, absolutely. And how many of them are you? Are there OTs and PTs? Is it just you?
Yeah, that's a great question, because when it first started, my manager talked to the administration, and they decided that I needed some further education, at least to get started. And at the time, we were looking into different courses, and they decided to send me to Hamman and Wallace to the pelvic floor 1 course. So there was waiting to go to that. And then they said, well, once she comes back, we'll get started. And that was in 2019. And then I had my 3rd child in July. So then I was off for a couple of months. But right now it's myself and 4 other OTs. So yeah, so how that worked was, first of all, it was just me. And then I trained 2 other therapists. And then we had some shifting around of staffing. And then I was moving over to outpatient therapy. So I had to train some more people to cover for when I wasn't there or not available. So now we have four OTs and myself who are all trained to cover. So it's not like you don't need necessarily extra training, because it's just stuff that we kind of already do. Like, we're already educating people after back surgery and abdominal surgery, how to move, how to do the log roll to get in and out of bed, how to breathe while you move. And if you don't know those things necessarily, it's pretty easy to get education on that. I think that it's nice to have some pelvic floor knowledge. It would be nice to have a knowledge base or someone to educate you about the basics. But I think that it's very OT, very doable. Like, how to sit on the toilet, how to take care of yourself after tears, and how to deal with the incision, and how to manage that down the road, and red flags to look for, like, urgency or urinary leakage, that kind of stuff that goes on past those 6 weeks. So I think that it's very doable for other OTs, but they have to have interest too.
Yes.
So that was one barrier for me, was that initially I presented this to the entire OT staff, which we only have 10 or 12 OTs, but people, when I first presented it, were like, no, I'm not doing this. Like, they were just set against it for various reasons. But there were other OTs that were like, yeah, this is something that interests me. So, you have to have the right people to do it, because if they're not interested or they're not passionate about it, then you're not going to get the right delivery of what you're trying to do. So, and in my hospital, it's just OTs. The physical therapists, there's a couple that might have interest, but it's really occasionally we'll call it a PT in if there's a significant change in their ambulatory status, and maybe they need some guidance on using the walker. But I feel pretty comfortable showing people how to use a walker. So I usually will do that. And if I feel like there's a PT need, or it's a safety concern where we might need two people to walk the patient, then we'll get PT involved.
Yeah. Hillary jumped on and said she loves this. So Hillary is actually a student that I was just recently speaking with about a desire to start a program for once a woman gets home, once a birthing person gets home and is between, getting home and that next visit, specifically around when people have had cesarean births. And so anyone is out there who is doing a service, has a company like this, and I know you're out there because I have spoken to you before and I just can't remember, but if you are out there and you have a business like this that is focusing specifically on supporting a birthing person between getting home and that 6-week visit with your care provider, will you please reach out to me and let me know, or you can contact Hillary Carlson directly, who just put a comment on, because she is very passionate about starting a service in this. Okay, there you have one already. Mal Brown is joining us and she says, me, Hillary. So you two connect, you're both on this amazing group, and give her your words of wisdom, Mal, because Hillary is extraordinarily passionate about this world. So I have another question for you, Jessica. So I'm getting a notification that I've got low system resources. Can you just let me know if you can still hear me?
I can hear you.
Awesome, great. So I had to switch computers last minute, so this one's giving me a little bit of an issue here. Hopefully it's okay. So my question is, you've already actually answered my question, which was to give me a sense of what your work is like, and you've just done that beautifully. I'm sure that it weaves in and out of so many things, but that gave us a nice snapshot. Will you give us a little bit more information about, you took OT Pioneers. It sounds like you also did Hamman and Wallace. You've done OT Elevate. I'm sure you've done other courses as well. My question for you is how does your knowledge as a pelvic floor therapist give us an example or a story or a snapshot into how, when you are able to address pelvic floor health, more specifically beyond breathing, what would that look like?
Trying to think. On breathing. Well, I think it's just mostly what we do is just education.
Yeah.
So it's just educating about trying to avoid bad habits of frequency, or straining on the toilet, or not drinking enough water. So it's typically, that's the kind of education that I give on those circumstances. I'm trying to think of an specific. It
sounds like a lot of planting seeds around what they need.
Yeah, that's exactly what it is. So I'm trying to think what else. Yeah, just
the book that you mentioned, my booklet, which by the way is still available completely for free on my website. You just go to functionalpelvis.com and it's one of the very first downloads that's available to you. It's like your guide for caring for your back, core, and pelvic floor. Have you guys made a version of that yourself to give to clients? Because my initial intention was actually that, because it's the guide for caring from basically 0 to 6 weeks postpartum. Do you guys give that out in maybe like their discharge folder?
Yeah, we have handouts that we give out. So we also have, we took your brochure, and I also purchased a guide from Hamman and Wallace. I think it's called, where is it? It's called Self-Care for Postpartum Mothers. It's kind of like handouts similar to your guide. And then we took some education materials off MedBridge that are about like how to carry your baby, how to hold your baby. And we kind of like put it all together into a packet.
Awesome.
And it's basically what we give them, we give them this whole informational handout with basically all the information about how to take care of yourself, how to care for your back, how to care for your pelvic floor. What else? Taking care of your bowel and your bladder function, what's normal, what's not normal. It talks about drinking water, how to get in and out of bed, how to lift your baby carrier, how to lift your baby, lower your baby on and off the changing table, how to lower your baby on and off the floor, and just the techniques that you use to move and take care of yourself. So we don't necessarily address specific. I do give education about the pelvic floor because a lot of moms now are coming in and asking specific questions like, should I do a bunch of Kegels? And so my education about that is usually like, I make sure that they know that it's as important to squeeze as it is to relax, and that they need to get that full range of motion. And, I show them the bicep comparison of like a tight pelvic floor has nowhere to go, and you need to make sure you can relax and contract. So I don't necessarily prescribe Kegels because that, I don't necessarily feel comfortable with that, but it is in their discharge paperwork from the hospital, from the OB doctors, that they should do so many a day.
Okay.
But I don't think that a lot of the patients even look at that. I know I didn't look at it when I had any of my kids. I didn't even know it was in there. And so I was, I usually just try to inform them, to watch for symptoms of urinary leakage or pain or feeling of something falling out or heaviness, and then just recommend that they come get a checkup after their 6-week visit or before if they need it. So just
That's
because
awesome.
I think it should be a standard of care that they should come in afterwards anyway. And the moms that I have seen have said, yes, like everybody should come here after they have a baby. So that would be my hope, is that someday everybody would at least have an evaluation and just get the information that they need.
So just to reiterate something that I think I heard you say right when we started our OT Empower Hour today, which is that you're both in the hospital and are you still in the outpatient center as well?
Yeah, so currently I am an outpatient pelvic floor therapist at our hospital that is attached to the acute care hospital. So I do, when my caseload is down or I have cancellations, I do run back and forth. So I am
okay.
But my goal is to eventually be
That's awesome.
entirely outpatient pelvic health, but I'm still growing a caseload. So.
Are there any other OTs in the outpatient department?
Just a hand therapist currently.
Okay. So how, when you're talking and educating your clients in the acute care facility, and you're weaving in all this beautiful education, how are you letting them know like how to follow up with the outpatient center? How is that education being handed over to them? Because I imagine, they're a bit, there's so much to take in. I mean, I would say there's so much to take in the first year plus, right? But especially in those first weeks or first few days, you're in the hospital and it's sort of like the information is overloaded. How do they know where they can go next? Like, how is that information being given to them if they do need to see a pelvic floor therapist afterwards?
Yeah, so in the back of our handout, there is a list of red flags or things to watch out for, or concerns that you may want to ask your doctor for a referral to pelvic floor therapy. And I usually include my card and a brochure for our program in there as well. Sometimes there are people that need therapy like right away, but I know they're going to be home with a newborn baby. So sometimes those are people that I would recommend to outpatient pelvic floor therapy. And I make sure that they have that information as well, because we have a bunch of really great at home care therapists in the area. So I make sure they have that information as well. You know,
That's awesome.
sometimes they're having extreme pain, tailbone pain, or pubic symphysis pain. And those are the ones I usually will recommend see somebody at home as soon as they get home.
Awesome. Awesome. We've got quite a few people joining us. I want to just reiterate to everybody, if they have any questions while we have Jessica, please go ahead and throw them into the comments. We'd love to hear from you. Also, Jessica is a really active member of our group. So if you have questions during the replay, or, as you're really digesting all of this amazing information she's giving with us or sharing with us, throw them in the comments. We'll be happy to look at your questions and reply. So are there any, or you've shared some of it with us, is there anything for any OTs who might be joining us who are interested in starting a program like this? Are there any words of wisdom? Are there any things that sort of you wish you knew before embarking on this journey that you could share with us?
There were some significant resources that I found. There is a OB, PT, and OT group. It's a Facebook group that is specifically for people wanting to start these programs, and they have a wealth of resources. So it's obstetric, physical therapy, and occupational therapy. And they just recently added occupational therapy to their title, which was, I thought, really awesome. There is a physical therapist named Ann Krogan. I think she was on Lynn Schulte's Birth Healing Summit. She did about the breastfeeding, about the latch. She is a really influential physical therapist, Ann Krogan. I think she's in Colorado, maybe, but she has a course on my PFM, and it's called Early Cesarean Rehabilitation. That was really incredible. And it basically helped me develop kind of how I was going to talk to the parents, and, specific like wording, and I don't know. It was just really awesome. I would definitely recommend anyone take it, and it's only $49. Yeah. And the other resource, what else was I going to tell you about? Obviously, your course, Lindsey, was very helpful, just giving that information about the pelvic floor and how it works and how it functions. And I found it to be very, very helpful and influential to giving me my knowledge base. And I wish all the OTs that I have doing the program now could take it, or would take it, so that they would have better knowledge too. There's a bunch of OTs in Indiana that are doing this program in acute care. I know I've met with Christy Kiesel. She is in Indiana, and we met over Zoom a couple times just to talk about our different issues we were running into with our programs. But I think that there are a lot of OTs out there doing this. Sometimes they're kind of co-treating with physical therapy, but there's definitely a lot out there. So I think, not a ton, but I'd like there to be more.
Yeah, well, it's, I think we're really realizing what an incredible presence we could have there. And I think as our confidence is growing, which it has been growing, I would say over I've had this group for, close to, 7 or 8 years, and it's growing so much. And our presence and our confidence is growing. And talks like this are exactly why I do that, because once we see what's possible, it just gives us all that opportunity to just lean into it and go, we've got this, we've got this. And I love that you've connected with those OTs in Indiana, right? We don't have to reinvent the wheel. Like I share all of my information, like my guidebook that Jessica used. Like I love people repurposing it. I mean, there is just no reason to reinvent anything when we've got all the resources in this incredibly growing community now of over almost 4,000 OTs. So thank you for sharing that information with us about Ann Krogan, about the My Pelvic Floor Muscle group thing. And I also posted the OB, PT, and OT Facebook group right here in the comment section for people who may want to join. I do have a question that came in from Mal for you. She said, this is so incredible. Can I ask how you connected with the home healthcare professionals? I want to provide home health post C-section, but I'm having trouble connecting with OB groups and hospitals.
I think it was, for me, it was just like a community thing. Like I met a friend and I don't even know how I connected with her. I think I saw her on this group and I saw that she was in Pittsburgh. So I sent her a message, and then we got together and we went for a walk. And then I found out that she was one of the therapists doing this home care, working for this home care agency. And so after I met her, I felt confident sending patients to her company because I'd met her and I knew that she was passionate about helping people. And I felt like, hey, I think it would be great if we could, I could hand patients off to you, you could hand patients off to me, kind of thing. It wasn't anything official, but it just kind of worked out that way.
Sure.
And my hospital doesn't have anyone that provides those services as far as I know. So it wasn't really, because you have to worry about that conflict of interest kind of thing, like, between different services and, who's within your network and that kind of thing.
Totally. Hillary is asking, what is the name of her company?
What is her company?
Yes.
I think the company that I refer to in Pittsburgh I think it's Pittsburgh Pelvic Health, I believe. I think it's just Pittsburgh Pelvic Health, or okay. I'm trying to think. There are a couple other ones that I think I have referred to also, depending on which one it is or where the people are located.
Cool. Mal said, that's awesome and so authentic. I love that. Thank you for sharing. And Tiffany Lee is joining us and says, love seeing you, Jessica.
Hi, Tiffany.
That's awesome. So if there's any other OTs joining us who have started a similar program or is working in a similar program, you didn't have to start it, you're just there, please make sure to let us know in the comments, because that will help Hillary and Mal and some of these other OTs that are really hoping to build a program in where they are, to maybe you guys can start an informal OT Facebook group or your own monthly Zoom meeting or something, because this is the thing, right? There's no reason for us not to knowledge share and just help each other grow. It sounds like Mal knows a PT named Rebecca Seagraves, who started an acute program in a large hospital in Colorado as well. So please let us know what you're doing and where you're at, and then maybe something informal can grow from this that will really help OTs shine in the acute care setting. Awesome. Are there any other questions for Jessica before we close? Please put them in the last remaining moments that we've got here. And Jessica, is there anything else that you wanted to mention that you may be thinking about that you'd love for OTs to know about?
I would just like to share that when I first started this, I was just really concerned about, like, how am I going to bill for this? What are the logistics of providing this service? But later on, I realized that, hey, we're already doing this kind of education with other populations. Like, we're already doing this with hips and knee replacements, and we're already doing this with patients that have had mastectomies. And sometimes those patients aren't able, they're not feeling well enough to get out of bed, but we're still educating them on the exercises and the precautions and how to dress and how to get in and out of the car and those types of things. And sometimes, when we go to these rooms, I see the patients usually within 24 hours after their cesarean. So sometimes they're not feeling up to getting up. So sometimes I may just have to encourage them to sit on the side of the bed and maybe do a stand and just practicing that kind of blow before you go kind of technique. But, you know, they're not always willing to do a whole lot, but you don't really have to get them to do a whole lot, in that you're providing so much education and just information. And even if they don't digest it all, just having you come into the room and holding that space and saying, hey, we're here for you. If you go home and you digest this information and you feel like there's something not right, we're here for you. All you have to do is call, you know, we're here to support you. And I think that's like the biggest takeaway from all of this, is that moms shouldn't feel alone when they leave, especially now with COVID going on and, you know, so much less support at home. Having them feel like there's someone there, there's an outlet, there's an option. It's not just them trying to get by and figure things out, because it's scary when you have some of these symptoms, or you're peeing your pants after you have your baby, and it's like, why is this happening? Or, you know, is it supposed to hurt like this? Or why does it hurt to poop? Like, all those things are like so scary for people, and it's helpful to just have that support system there in place for them. And I think right now it's more important than ever.
I couldn't agree with you more. I love everything you said and 100% agree. It was such a powerful message. I actually have one more question for you. When we spoke earlier, you said that when you were in that initial meeting, right, where your topic got moved to the very last topic of the day, one of the questions that doctors had or hesitations was, how are we going to be able to refer to you? How was that resolved in your setting?
Well, it's not 100% resolved, because I think it's one of those things where, you know, with the hospital system and the computer system, what needs to happen is it needs to become a standard order, or it needs to get into the system so that it can be just a checkbox, rather than having to have the doctor specifically write for it. So in my system, that is still where the hiccup is, in that it's not part of their standard order set to refer. So that is still in process. So, you know, these things take time, but my hope is that it will become a standard order. When they click on the rest of their orders, it will automatically populate, and it'll be something that happens routinely. Whereas right now it's kind of like when they think of it, but it's going to get better. And I don't think it's intentional.
100%.
I think it's just habits. You know, we all have habits in our work.
Oh yeah.
And, you know, they have a lot of concerns about making sure mom is healthy and, you know, has a good blood count and good blood pressure, and, you know, OT for pelvic floor and OT for moms isn't necessarily their priority. But I hope that eventually it becomes standard.
Absolutely. So Karina just had a few things to share. She said, I've created a proposal to start a program like this in a local hospital, but I don't work in the hospital. I feel like that's a big barrier for me. It's a lot about who you know. I don't know who to share this proposal with. I did send it out to my OB, who was very much interested in the program. So that's a good start.
Yeah. I would say connect with the therapists that are in that hospital somehow. I don't know, call the department, and if there's interest, I think that it's definitely very doable. But again, you have to have the right therapists to do it.
I wonder if you could do an in-service, I wonder if there's something there where, to me, calls sometimes fall flat, and they don't get to the right person, and it's just not a priority with all the things that we do in these busy hospitals. So I wonder, Karina, if there's some way that you can show up in person and befriend the director, befriend another OT who's just as passionate about this as I know you are. And you can make traction that way. You can do some sort of in-service talking about how this is possible, sharing the, ins and outs of your proposal. I'm just a big fan of in-person connections. That's how I ended up getting my first job at an outpatient center. It was a PT job that had been open for over a year. My resume kept getting overlooked by HR because I wasn't a PT, and I met in person, and that is what completely, jet started my career. So I'm a big fan of showing your passion and actually walking in person and sharing this information. Amazing. All right. One last question. Hillary was wondering if the program you're describing is a cash-based program?
Cash-based.
Like how is billing for this service is what she's wondering.
It's all through the hospital. So it's just like we would bill for any other eval and treatment. So it's all under their billing codes for their admission. So that was a big concern for me. Like, how is this going to get paid for? And is this going to be, is this going to be an extra charge on their bill? That was a concern. But they've assured me that it goes under their hospital admission and their stay. So as far as I know, that's how it works.
Amazing.
But that definitely was a concern of mine.
Amazing. Oh, Jessica, I'm so excited to have had this conversation with you today. I know this is so inspiring and has sparked so many creative thoughts for so many OTs that are interested in pursuing this further. So thank you so much for your time and your initiative and for being a champion for OTs.
Oh, thank you. And thank you for all the work you do as well.
Awesome. Awesome. Everyone have a great day. I can't wait to see you next week for the next OT Empower Hour.
Thank you.
Take care, everyone.
Bye. Oops, I was supposed to stick around.